Good afternoon and welcome to our March Dementia Dialogue. My name is Heather Mulder. I'm the Outreach Program Manager at Banner Alzheimer's Institute, and I will be your moderator today for the call. A bit of housekeeping before we get started today. You will have the opportunity to submit text questions to today's presenter by typing your questions in the question pane of the control panel. You can send in these questions at any time during the presentation. However, we will collect them and address them during the question and answer session at the end of today's presentation. The session today is also being recorded, and it will be posted on our website within 48 hours of the end of today's broadcast for future reference. It's my pleasure today to introduce our presenter, Mary Lou Hernandez. Mary Lou is a licensed clinical social worker specializing in the care of older adults. She's an expert in helping families and people with Alzheimer's and dementia find and access health care. She also identifies community resources that allow people with Alzheimer's and dementia to live and function successfully in society. And in my experience with Mary Lou, I know one of her main areas of interest is really helping families to plan ahead and know all of the options available to make the most educated decision possible, which is why this topic today is perfect for her to discuss with you. When home is no longer working, how to handle the care transition. Let's hear from Mary Lou.
Thank you, Heather. So thank you, everybody, for attending the webinar. So I always like to start with saying that as people with Alzheimer's disease or a related dementia progress, many times families will need to consider a residential care setting when home is no longer able to work out. And it's different for everybody. Family situations and social supports are different and unique for all family members. So in this webinar, we're going to discuss the levels of care that are available, what types of situations are important and helpful in considering a move, because families frequently ask me, when will I know that it's time? And again, it's very different for every family. I'm a very big advocate of planning ahead, thinking about the options before they're needed immediately. So you're being able to plan and have time to do it without being in an emergency or a crisis. And then how do you prepare for and actually make the move? So to start with, in Arizona, the residential care settings are licensed by the Arizona State Department of Health Services. And there's various levels of care that are available. An adult foster care home is a setting that can house 5 people or less. It's a private home, and typically the people that own the home are living there. Assisted living homes are 10 or less people, and again, they're typically private homes, but some people will own several homes, and they hire staff to care for the residents that live there. Assisted living centers are larger centers, 10 or more people, and they can have a menu of services that are available. So an assisted living center will have assistance with managing meds or assistance with bathing or providing meals. So it sort of depends what a person needs, and families or the person that's living there can pick and choose. Assisted living memory centers are more specialized care centers that are licensed as directed care, meaning that more hands-on care can be provided. And many of our memory patients that have a dementia can reside in a memory care center until the end stages. There's many assisted living centers that have a memory center within the confines of that particular facility. And skilled nursing facilities are the highest level of care. They're typically Medicare certified. Many people will go to a skilled nursing facility after being in a hospital for a rehabilitation type stay or a recovery stay that Medicare would cover. But there are some skilled nursing facilities that have a dementia unit. So most of my patients, I would say, would be going to an assisted living center and eventually an assisted living memory center. Probably the next frequent used types of centers are the assisted living homes. I have very few patients that reside long-term in a skilled nursing facility. Continuing care retirement communities are the larger communities that you see scattered in Maricopa County. Excuse me. We have quite a few continuing care retirement communities that have all levels of care. They may start with independent apartments. They would have an assisted living center. They may then have a memory unit, and many of them even have a skilled nursing facility. So it really allows a person to age in place. As their needs progress, they have all the levels of care that may be necessary. So many times, couples that have one person with a dementia diagnosis will consider moving to a continuing care retirement community where the well spouse and the person with memory loss can be together, and as the person with memory loss needs more care, there is a level of care that can be helpful for them. Or a person that has a very mild memory loss may, again, consider going to a place that has progressive levels of care, so as their needs increase, they have the support near them. Arizona Care Check is a link that you can access online to review the Arizona State Health Services surveys and investigations. So there's information about each center. If there's been complaints, it would be logged on there. So it's a way some people like to have more data or feedback, and it's a way that you can check that. So when do you consider a transition to a residential setting, or when do you start thinking about it? And as I said before, all families are unique, so it is different for everybody. However, when a person with dementia is living alone, as their dementia progresses, they will not be safe to continue living alone. So in the early stages, they may be okay, but as their dementia progresses, there are certain things that we are going to want to encourage families to look at so that they're aware of what's happening. So, so when the person with dementia is living alone, they may want to move. I've seen some people that'll say, I know I have a memory issue, I know it'll get worse, I'd rather move when I can adapt easily to a new setting. So they may also need to move if families are observing that their daily abilities, they're having more difficulty with that, or when there's safety concerns. So we really look at a number of factors. Are they losing weight? Because maybe they're forgetting to eat. Are they having difficulty with using the stove? Are they leaving the stove on? Are you going to visit them and there's food in the microwave from the day before that they forgot to take out? Are they putting incorrect items in the microwave, such as metal or plastic in the oven that's going to melt? Are they having difficulty taking their medications, whether they're forgetting or whether they're taking too many? Because maybe they're using a pill box and they're forgetting the day. So they may think that today is Thursday when it's really Wednesday, and take Thursday's meds, and then something alerts them that it's Wednesday, and all of a sudden they're taking Wednesdays again. Are they able to keep up their house and their yard work and cleaning the house? Are they having trouble with the thermostat? Because even a thermostat they're used to using can all of a sudden be confusing. So families may go in the house and it could be 100 degrees in the house because they've turned the heat up or they've turned the air conditioner off and it's very hot. So all those things are very concerning, and we really want families to keep their eyes on what's happening and be aware. And there's times that the person with dementia might be fearful of being alone. So you may see their windows closed at night. They may talk about somebody knocking on the door and they're scared of who's out there. They may be scared of the dark because at night shadows can be fearful. So again, when somebody's living alone, those are very important things for families to be aware of. If the person with dementia is living with a spouse or family members, again, when are you considering a move? So you could have the caregiver working full-time and the person with dementia is alone all day. So again, some of the safety concerns that we discussed about the person living alone can still hold true for a person that's living with another family member that's gone all day. Additionally, the person that works full-time has a full-time job, and they may come home and have a full-time job to care for the person with dementia, and that can be exhausting. So not only are we concerned about their safety of being left at home alone, but also the ability for the person that's the primary caregiver to have all those responsibilities. As the dementia progresses, the physical care needs may be too difficult for a person to manage, the caregiver. And again, this varies with different people. So some families will say, you know, I can't care for my person when they're incontinent because it'll be too difficult to manage that. We may have a daughter caring for a father, and maybe she's uncomfortable helping him with personal care. So perhaps when personal care changes, that may make a difference. If the person needs more physical assistance and the caregiver is unable to do that, that may make a difference. The caregivers many times become physically and or emotionally exhausted. When you're a caregiver for a person with dementia, whether it's a spouse or a family member, your responsibilities increase and your stress level increases, and you're doing so much more. And you have your own responsibilities. So it can be very trying. And again, we look at the stress level of the primary caregiver and how you're coping. And it's sometimes a trigger point for people to make decisions that they can no longer do this. Many times the primary caregiver becomes ill, or they're fragile. They have their own health needs. So I have patients with memory disorders that are physically energetic, but their spouse may have a lot of medical illnesses. They may be using an assistive device to walk with, or they may have multiple medical conditions that make them unable to do a lot of the things in the household that they're having to assume. So again, that may make a difference for a transition. Unfortunately and sadly, many times a caregiver unexpectedly passes away. And again, all of a sudden, that was a person that was able to make things go well for the person with dementia, and they're no longer there. So then what happens? I had a sad situation with a young adult caregiver. She was in her 40s, and she had an unfortunate accident when she was putting up Christmas lights and fell off a ladder and passed away. It was very unexpected, and she was really the core of caring for her mother. And then there are times when a couple want to transition to a continuing care retirement community so that the well spouse has support and there's care for the person eventually that has the dementia, so they can be in the same setting. And some of the household responsibilities are gone, and the well spouse doesn't have to worry about yard work and household chores and cooking, and there's activities right there for them. It's always important to think about financial planning when you're considering a transition. So just as an offside, we do have a class that addresses this at Banner Alzheimer's Institute called Planning Ahead, and it is also filmed on our website at banneralz.org. So I'm going to briefly mention this because this is a class in itself. But when you're looking at making a transition, you have to know where finances are, because clearly it's an expense. So are there funds to pay for a residential care setting? Because many times it will be started as a private pay basis. Is there long-term care insurance? This would have been something that the person would have purchased when they were in good health, not after they have a dementia diagnosis. So, so it's important to see if there's long-term care insurance. If there is, review the policy. Know when to enact it so that you're using it, because long-term care insurance is expensive and you want to obtain the benefit from it. Will Alltex or Arizona Long-Term Care, which is the Medicaid program in Arizona, need to be applied for? Again, this is usually when resources are spent. However, it's always important to be aware of the well spouse protection, because when there's a couple, there's a certain amount of their savings that are protected for the well spouse. And currently in Arizona, that amount is, they just raised the limit. So right now, half of a couple's shared assets, up to $120,900, is reserved for the well spouse when the person needs care on a daily basis. And also, will there be VA aid and attendance benefits? Again, this is a benefit that can be paid for a veteran, a surviving spouse, or a couple, for a veteran that served 90 days of active duty, with 1 day being during a period of war. And again, all of these programs can be viewed more specifically by attending Planning Ahead or viewing this on our website. And I always like to mention that Medicare, Medicare supplements, Medicare Advantage plans do not pay for residential care facilities. They cover a short-term stay in a skilled nursing facility when there's a skilled need. And so they're not a long-term care plan. So when you're planning for a residential care setting, I can't stress more urgently that you want to be proactive. You want to visit centers before they're needed. It's much easier to visit at your leisure than to have to make a decision in a day or two. So if you're thinking that something might be needed in the next 6 months, in the next year, start visiting centers so that you have some idea of what's available, that you can really feel like you're making a good decision, and so you're not feeling stressed about your decision. So think about locations that are near home or family. If families all spread out within the area, especially here in Maricopa County, we have centers all the way from Surprise to Apache Junction. So where would that person want to be? If there's family all over, who's going to visit them the most? And be realistic about that. I've had families move a person to be near a family member that's really not visiting, and perhaps the person that really is the advocate and really being more available is driving quite a distance every day to visit their loved one. So you really want to look at what the best place would be. You want to visit several centers so you can compare and contrast, so you're making a good decision. If you picked a few places that you like, go back unannounced. You might want to get the official tour, but maybe you go back so that they're not, you know, you're seeing things just as somebody walking in and them not expecting you and preparing. You want to ask questions. Questions are very important. When I see patients, we give out a list of questions to ask when visiting an assisted living memory unit. So it lists a number of different options for you to think about, and people can add additional questions because sometimes there's other things that are important to you that we may not have on our list. But we encourage you to fill a form out for each center. Write notes. Be sure that you're jotting down your thoughts and your concerns, because you may forget that some of the information. Or if you see 3 or 4 places on one day, it's easy to get things mixed up. Have other family members fill out the forms and get their feedback. You want to make sure the staff has dementia training so they know how to best manage your person when they're at the dementia unit. Look at the other residents. Do they look happy? Do they look engaged? Are there activities going on? Do they look comfortable? Are they clean and well cared for? And look at the activities that are offered, because again, what's helpful for people with memory loss is having activities that are cognitively stimulating, that are at the level they can be successful with. So you want to make sure that they can be engaged and that they're offered different options, that there's other people they can socialize with. The TV is not the best activity, so we want to make sure that there's things other than the television that they can participate in during the day. You want to look beyond the pretty decor and the paintings on the wall and the window hangings. You want to make sure that it's a safe setting and that the care is good. Quality of care is really the most important. Does your person have medical needs that need to be managed? Do they have special diets? Are they diabetic? Are there things that are particular to them that you want to make sure that the centers can or cannot manage, because that may make a difference? Is there a waiting list? You may really like a center and perhaps there is a waiting list. So we encourage people to place your name on the waiting list. If you're not ready when the name comes up, just ask to go on the next spot. But at least it gives you some options. And if something unexpected happens, you're one step ahead. A number of memory centers actually have day programs where a person can go during the day, participate in activities, and then go home at night. And it's one way of promoting familiarity. Your person goes there during the day, it's not a move, but if down the road they need to move, they're comfortable and familiar, but you're also aware of the level of care and what the center is like. So it can help everybody feel more comfortable with the transition. Some people will test the center with a respite stay, a short stay, maybe a week or two, or maybe a few days. I had a couple that were caring for their mother, and they went on vacation several times a year, and mom went to the memory center that was right in the neighborhood. It was her vacation, they went on their vacation, but then mom came home. But their plan was that when mom needed a full-time center, that's where they would move her. So they knew what it was like, and they knew how she reacted to the setting. And I always encourage families that if Arizona long-term care or a long-term Medicaid program will be needed even in the future, you want to make sure that the center that you choose has a contract and can cover that person under all tax when they need that payment source. It makes it much easier to transition from private pay to all tax if the center has an all tax contract than if you have somebody at a center that doesn't, and then you have to move your person. And maybe centers will be more likely to keep a person that's paid privately because they know you. They've had a contract with you, an engagement with you. So it's more difficult for your person with memory loss to all of a sudden have to move to a new place once they've accommodated and been comfortable. So again, it's one of the questions to ask. Do you have an all-tax or a long-term Medicaid contract for future use? So should a person with dementia be involved in the planning? So when I talk about planning way ahead, that can be stressful for a person with dementia. If the person with dementia is in the early stage and they really want to move, I encourage families to really do the busy work, view all the places, and maybe pick the best 2 to 3 centers for them to visit. It's less overwhelming and less exhausting for them. And again, decision making can be difficult, so you're helping with that for them. If the person is resistant or in the moderate stage and really is having a hard time remembering all the information, it's best not to involve them with the planning. Because pre-planning is helpful for families, but the person with dementia doesn't always understand that big picture. They may hear pieces of it, so you may say, oh, we're looking at this for the future, and they may think that it's going to happen tomorrow. So I usually suggest that families do that in the background. You're doing it for your benefit to help them down the road, but it can be very overwhelming and confusing and anxiety-provoking for the person with dementia. And in the advanced stage, planning is way too confusing. They wouldn't understand. So again, when we're planning, I'm a big advocate for thinking ahead, but many times a crisis can occur where a plan needs to be expedited or quick decisions made. Many times a person with dementia is hospitalized and they're not allowed to return home, especially if they're living alone. I've had family members call me from the hospital and say, the doctors won't let mom go home alone. What am I going to do? So again, if you've done some planning and you have some options, it still can be a crisis and a quick decision, but you've got a little information under your belt. And again, as I said before, sometimes a caregiver can become sick or pass away or have an accident or maybe be hospitalized for an unexpected length of time. And if that person was a primary caregiver, who will be available, or does a you know, if there's no family in town, maybe a placement will be necessary more imminently. And then sometimes there's critical safety concerns. Is the person making medication errors? Are they in the hospital because maybe they've overdosed themselves or they haven't taken enough of a medication and it's made them very ill? Are they wandering? Are the police bringing them home? Are they leaving the house? And sometimes there can be aggression or behavior changes that are unexpected. I remember in our support group we had a woman who always talked about how calm her husband was and probably wouldn't need to make any changes for a long time. And she came back to the group after we hadn't seen her for a month and told us that her husband became very aggressive and was hospitalized, and she had to place him, and it was very unexpected for her. And again, she, you know, the aggression wasn't expected, but behavior changes can occur. So a lot of times things will happen more quickly than you would have thought. So when you're preparing for the move, if the person with dementia is involved and they're agreeable and they know about it, it's still important to be aware that change is stressful. It can be difficult. So you want to discuss the move maybe a few weeks before, not months before, because again, they may be more anxious and worried about it. It's very common for them to have anticipatory anxiety. As things get closer, they start worrying. What's it going to be like? Am I going to like it? Is it going to be okay? You're not going to be there. So you want to speak positively about the change. You want to reassure their fears and that you're going to be there for them and that you'll help them with the new environment, and maybe take them to lunch at the center so they have some familiarity. They can see what it's like. They can have an image in their mind about when they're going. But when the person's in the moderate or the severe stage, talking about moving before it occurs can lead to anxiety, confusion, sometimes even resistance. It's not uncommon that people will vacillate about moving. Yes, I want to move. No, I don't want to move. Yes, I want to move. No, I don't want to move. So you really want to look at how that person will cope with it. Sometimes the less said, the better, because it can be very anxiety-provoking and scary. When a person is resistant, sometimes families have to be creative in how that move is going to occur. So I've listed some creative ideas that families have come up with, or we've come up with together as a plan. So when there's a couple, many times you can say that the spouse needs care. Not the person with dementia, but the spouse. Maybe they have medical conditions and the doctor says you really need to not manage the house anymore. You need to be in a place where you can have assistance. So of course the person with dementia needs to move with them because they couldn't bear to live without them. So many times you're taking the focus away from the person with dementia and putting it on the spouse who doesn't have the dementia but maybe has a medical condition that you're moving for, even though maybe you really are moving for the person with dementia. Sometimes families will say the move was ordered by the doctor, and our doctors will usually agree to say, oh, you really can't live alone anymore, this is important, necessary, and then families really then can put the blame on the doctor. You know, I have to do what the doctor said, and you focus more on the emotions of the person, but have to follow the doctor's direction. Sometimes the house needs to be vacated to fix a problem. I had one family whose mother was living alone, and they found a place for her to move and said, there's all these pipes leaking under your house and the city has to fix it and you really have to move. And she moved and adapted very well. So sometimes it can be in the middle of summer and the air conditioner is broken and you can't live there because it's unsafe. So sometimes things happen in the house. We have to renovate this and you can't be in the house. We have to get mold out of the wall. So families think of all different things why the house may have to be vacated. Sometimes the doctor orders special therapy or special care for the person. I have one wife whose husband went into a memory care unit for a, quote, clinical trial, end quote. So he really wasn't going for a trial, but the center used that reason, and the wife did, and it made him feel that he was going there for a purpose, so he was agreeable. So the clinical trial is continuing. Many times family members or children step in and make the decision. This has to be done, you know, they get together, they have a family meeting, and sometimes if they're direct about it and state it needs to be done, the person or the couple will even go along with it. Occasionally you can say that this is temporary or we're just testing the situation so that they're not feeling that it's going to be forever. Then they may feel better saying, oh, we're just going to see how it works. And if a person is hospitalized or goes to the ER and you know you want to make a transition, being able to go right from a hospital setting as a step down can be a good way to have the person move, because then the doctor's ordering it, the hospital's ordering it, it's part of your discharge plan. So it sometimes is easier for that person to accept because they just sort of go along with the plan that was made from the hospital. So be aware that packing and downsizing and actually the physical aspects of the move can be very overwhelming for the person with dementia. So when I've had couples that are downsizing and moving to a retirement community, the person that has memory loss, even if they're in the early stages, can really have difficulty deciding what to keep, what not to keep. If families are coming in to give things away, that can be so disturbing. Sometimes they'll just move things from one box to another, or they'll feel like, oh, this is important, I shouldn't have given that away. So you really want to be realistic about what that person can accomplish and how much they can be involved. You want to involve them for shorter periods of time, sometimes going in and really packing the things that may not be as significant for them will get things accomplished so that they're not feeling there's so much that they have to be involved with. So you want to bring possessions that are sentimental and be sensitive about keeping them, even if they're not all going to be brought. You might be able to assure them that, well, we have them, they're in a storage, or they're still at your house because maybe the house hasn't been sold, or we have them in our house, so that they're not feeling bad about that. Sometimes having other family members come in and just, you know, really try to pack for them can be helpful. A moving company can also be helpful. Many of the retirement communities contract with moving companies that can come in and just do a lot for the family so that it's not so overwhelming. And if the person's not aware of the move, then many times packing occurs after the transition is made. So again, when you're preparing for the move, especially if it's a person going into a smaller setting, maybe not an apartment, you want to have their room ready with familiar items. You want them to feel comfortable, even if it's their apartment. What things that are sentimental for them are there so that it still feels like home. Sometimes before the move, we encourage families to consider starting a calming medication so that it helps ease the anxiety of the person before the move. And our doctors readily write prescriptions prior to this. And many times it'll continue for a period of time into the move so that it can help adjust it. And then as they're being comfortable in the setting and learning, then those medications may be stopped. And then you want to let the staff know about the person, especially again if they're there alone and maybe not in a retirement community with a spouse. So it's important that the staff knows what they like, what they don't like, what their mood and temperament is like. Are they easygoing? Are there things that are going to irritate them more? Do they have certain habits that would be helpful for the staff to know? Because it just helps them to help that person feel settled in. You want the staff to know who they are. What do they do for a living? It gives, what's their family situation? Where have they lived? Were they in the service? Because it gives the staff topics of conversation so that it can help the person feel comfortable and help them to adapt. And I always want to focus on the importance of emotions during the transition. Moving and making a change is very emotional. And sometimes family members especially, because if you're not sharing it with a person, you have a lot of emotion about how they're going to accept this, what's going to happen. Many times the family members are fearful and anxious about the whole transition, and many times relieved after it occurs. But any change can cause anxiety and fear of the unknown. But a change in residence, a new place to live, that can especially promote that. Many times, moving makes a person feel that they're losing their independence. They're no longer able to do all the things that they could do, and many people with dementia feel that they're still doing things well. So they may feel that their independence is being reduced, and they may feel a sense of loss or grief. And we frequently state that one of the ways for a person to maintain their independence is to have more assistance. So a person that moves in the early stage, by having all the services available and not having to cook meals or worry about transportation and having activities right there, they may have a sense of independence longer. And they may feel that once they've moved. So leaving home or the things that are familiar to them, especially if a person has lived in a home for many years, they can feel sad or angry about it because this is where they've been for so long and they don't want to move. Sometimes, however, not having all the responsibilities can provide a sense of relief, and it can make families be aware that their person's more safe. So, so there are some positive emotions that can come from that. And again, considering a move or after the move, I hear frequently from caregivers that I feel guilty. I feel guilty that I'm thinking about this. I feel guilty that my person moved, and maybe I should be taking care of them. That's my role. And that's a hard thing, but maybe they're getting better care where they're at, or maybe it was too difficult for you to do that. We really don't want you to feel guilty about it. We want you to look at the fact that what are the positive things they're getting, because you're still their advocate. You haven't given up on them. So, and sometimes just the sadness of the person not being there. So when a caregiver spent so much time caring for a person and now they're not in the home, sometimes the caregiver really doesn't know what to do with themselves, and they can be sad about that. occasionally there's family discord about the move, and many times there's one or two family members that are more involved in the planning and doing all the activities, and that can lead to disagreements and resentments, and again, a lot of emotions. Family members that live out of state, family members that are here feel they have all the responsibility and they're not getting a lot of respite. So family discord can be difficult. We do encourage, though, that if the caregivers are emotional, you want to try to not make it as obvious, because the person with dementia, they may not understand what's going on, but if they see you're upset, they may become upset. So during and after the move, we always encourage the caregiver or a family member to be present. We want to make sure that you're there to make sure that person is settled in, they know that you're still with them. Because one of the biggest fears of a person, especially as they're progressing in the dementia, is that my family's going to abandon me. So you want to reassure the person that you're going to visit, you'll be back soon. We encourage family members to visit daily after the move, for short periods of time. There are some centers that will say, don't come back for 2 weeks or 3 weeks. We want to get them settled in. And I think in most circumstances, we want family members to visit. But you may not want to visit and stay all day. Maybe you go and stay for half an hour. And then we suggest that you coordinate leaving with a meal or an activity, so that you're planning to leave. Maybe your person goes to lunch and you sort of slip out. Maybe you say, oh, I'm going to the restroom, and then you just leave. You want to really minimize emotional goodbyes, because if you're there, bye, I'll see you tomorrow, saying goodbye is going to make your person want to say, take me with you. So if you slip out and you try to make it less emotional, it may help them to feel less stressed. Sometimes when you visit, bring a treat, bring an activity, bring something they like, so that they're feeling special. And ask the staff to keep a close watch on your person, so that they have some extra attention. And then when you're visiting, or if you call, you can ask how they're doing. The more positive of a relationship you have with the care staff, the more that this is going to reflect on the person with dementia. It's always, you want to be an advocate and you want to be sure that you're getting good care, but you don't want to just talk about the negative things you're seeing. You want to also talk about the positive and how well the staff is caring for your person. So know that there's going to be an adjustment period for the person with dementia after a move. There's a lot of new things they need to learn. There's going to be new people, new faces, new routines. They have to become familiar with their apartment or their room. They have to learn where they're going to eat. There'll be maybe new food choices. There'll be new people that they're eating with. All of this is new, and it can be frightening, but it will take them time to learn and to adjust. So give them time. They may be agitated at first or angry, but eventually they will adjust. You give them time to express their emotions. Be reassuring to them, but let them say what they feel. We always say to be cautious about taking the person out of the facility initially, because they may think you're taking them home. So maybe wait a month and see how they do. You may need to wait a little bit longer, but a person can be taken out. I have families that will say, well, once they're there, do they have to stay? No, you can take a person out for lunch. You can take them to your house, but you want to make sure you do it at a time when they're comfortable going back. So again, give them time. They will adjust. They will adapt. And then it's always important to know that for spouses, for family members, for significant others, you're still an important part of that person's life. You still will be their advocate. You want to make sure that everything's going well for them. But once they're in a care facility where you're not doing all the hands-on care, you can return to being a spouse or a son or a friend or a family member or a partner. So you're able to spend quality of time with them rather than trying to get them to do things that they may be resistant to or having all the responsibilities. So the roles change, and it can be a change for a positive. And we always encourage caregivers to take care of yourselves. You know, this can be very emotional for you as well as for the person that's moved. So you want to have outlets for yourself. Maybe this is a time where you consider going to a support group, whether it's at the facility if they have one or in the community. Being around peers that have made this transition can help you to adjust. And then you may be able to give people advice if you're in a support group. You know, if you need counseling, you know, feel free to have somebody to speak with. I frequently speak with caregivers after a person's transition to a assisted living center, as we are still managing that person's care and we're helping you cope with that change. So really focus on your needs and go and do something fun, because maybe you have more time. Maybe you can finally get back to the bridge game, or you can go out to lunch with friends, or you can go exercise more. Maybe the things that you've neglected, you can now start taking care of. So take care of yourself. Questions?
Thank you, Mary Lou, for a very comprehensive discussion, really looking at all of the different angles about when to transition someone, all the way through how to support them after they move. I know a lot of people have found this to be valuable, and we've had quite a few questions come in already that I'll start sharing with you. Before I do that, I will mention that to all of our participants, if you have questions, enter them on the text or the question portion of your control panel. So the first question that we had come in is kind of taking a step back. So this program really focused on when it's time to move the person. But we had one of our participants asking, when do you know if bringing in a home health aide is the right answer, or when it's time to move them to a different environment? Do you have strategies?
Yeah, some of that maybe depends on how much care is needed. So, you know, we talk a lot about home health aides being helpful to give the primary caregiver a respite break. So, you know, having somebody in maybe 2 or 3 times a week so the caregiver can go and do their own activities. But if more and more care is needed, and in-home care is expensive, you know, you're looking at $23 to $25 an hour. So a home health aide on a full-time basis is outrageously expensive. So sometimes you're comparing the cost. And again, even if you have a home health aide, the primary caregiver is still there more hours. So are they able to manage that? So some of it depends on how much care is needed. Some of it depends on the cost that you're looking at.
Okay. Yeah, those are all good ideas when considering that. And I know we keep saying it goes back to every situation is different.
Exactly.
You really have to take a step back and assess what are your resources, what are the benefits, and what are the drawbacks, and make the best decision that works for your particular situation.
Exactly. And sometimes finances, insurance, benefits all make a difference as to what you can have available to you.
Right. So another question, I have a series of questions that I'm going to kind of cluster together that hopefully you can comment on. This person is asking again about home care, but perhaps you could interject with the facility-based response as well. And so they're having trouble hiring an in-home care aide, finding one that's prepared and has dementia training. So the first part of their question was, is dementia training regulated and mandated? Maybe you could speak to in-home care and residential settings.
As far as in-home care, the agencies that provide non-medical in-home care are not licensed. So I believe that's an individual criteria for the agency to give their caregivers training. So if you're using an in-home care agency, you're going to want to ask what their training requirements are, because I don't believe the state mandates that, no. So you're going to ask specifically, how do you train your caregivers? What, do they have continuing education? If you give them a training program, what do you give them? And again, there's a lot of agencies in our county that are available. And again, it could be that you have to interview those caregivers, because I think some people just understand dementia better than others, even if they've had a training program. So I think some people have more of a knack for it even. In the residential settings, if it's a dementia-specific unit, the goal is that the facility will give training, because the caregivers are having to provide care. I'm not sure if the state mandates that, but again, that's a question that what we have on our list. What is your dementia training? How many hours is your person given continuing education on this?
So then along those lines, assuming that perhaps you're running into an agency that does not offer training, is it possible to insist that they obtain the training as a condition of hiring them?
You could ask. I don't know if they would comply. I think there's so many agencies out there that I guess I would say pick another agency, to be honest with you. Yeah. There's multiple agencies in Maricopa County.
And sorry, go on.
Oh, no, go ahead.
So the third part of that question, and you kind of touched on this when you mentioned some people just kind of have the knack, but should a person always be certified in dementia care or have some kind of ongoing training?
Again, I think it's helpful, but it just depends on what's being offered to them. The in-home care. So the in-home care agencies and the people that work at the dementia centers, they're probably more of a nursing assistant level of care. So, their training is basic, but, allowing them to have ongoing training certainly is something you want to ask about. I've seen caregivers that actually come to some of our classes because they want to learn, and those are the types of people that you would want to have involved. There's a lot of education online. So, if you have a caregiver, maybe you really like them, maybe they have a good way with your person, but maybe they could use more training. As a employer, you could even offer to them. There's some classes at Banner, there's some classes online, there's some books you can read. So there's a lot of ways that they can do it even on their own if they really want to learn more.
Great. Thank you. Another question that's come in, I'm going to try to generalize it. It has some specifics in it, but this is a long-distance caregiver that's writing in who is concerned about his parents who actually live in Minnesota, so halfway across the country, totally different climate than we're looking at, and they are just starting to become open to the idea of moving into a residential facility. He is looking for your thoughts on how to decide, should they move to a facility in Minnesota or move them out to Arizona?
So I guess my first thought would be, is there other family in Minnesota? So if you're a long-distance caregiver and there's no family in Minnesota, then I would think that it would be easier for them to be close to you as an advocate, so that you can make sure that as things change, their care needs are being met. It's much more difficult to be an advocate long distance than it is to have somebody close by. If they're in the hospital, you have to jump on a plane and fly to Minnesota. If it's in the middle of winter, that could be even more problematic. But those are always difficult discussions, because we have a lot of people in Arizona that retired out here and their family is not here. And so they may have to go to the bad weather, because again, it's easier to be an advocate when the person's geographically close. It's much harder to be a long distance. And even though it may be comfortable and home for them, as care needs increase, the outdoor setting may not be as important as who's close by and who's coming to visit.
Mm-hmm. Yeah, great thoughts on that. So our next question is, we're prior to the move, or we're verging on the move right now, and you mentioned many times when people especially are moving from their home to a residential setting, it's downsizing.
Right.
Are you aware of any services that can help to create an estate sale, or do you know anything about how that works? How do you empty out a house of all of its contents?
You know, I know there are agencies, but I don't, at the top of my head, know the name of them. I would Google that, or the many of the retirement communities know about that, because they're there to offer all of the things to make that move successful. But I'm sure there are agencies that can do that. Yes. I just, at the top of my head, I don't have a list, or I don't have the names, but I think
Right.
you could do a search for that, and I'm sure there's agencies that would do that. Yes.
And that's a great strategy. Just go straight to the facility, because I'm sure they would have lists of organizations close by. And I anecdotally, in the caregivers that I've worked with, have run into some who have used these services and just absolutely rave about the stress that it takes off their shoulders in the moving process.
I know I had somebody recently, well, and actually in the past year, that moved, and the community that she moved to arranged all that for the son, who was out of state, to help his mom move.
Great.
So yes, so I go to the communities first and see. But Google is great.
Right. So I think we have just time for one more question. So to any of you whose questions are not addressed, we'll make sure that we get them to Mary Lou so that we can respond to them over email to you. But the final one that I have, I think, is an interesting one. Is it good to have a cognitive test or a cognitive screening done before they transition, so that the facility has a kind of baseline and know what the person can do both functionally and cognitively?
Well, I think it depends on, I'm wondering if you're thinking of a full cognitive screen. So for our patients, we have sort of a baseline. We know the stage they're at. So families can discuss that with whatever community they're moving to. Frequently, the retirement communities or the memory care or assisted living will actually come and interview the person. So I have a lot of my families that will say, the center's come to meet my mom or my spouse. They came to see them, because sometimes they make that decision. So yeah, I think the more information, of course, the better. So if you have an idea of where they're at, what stage they're at, it's going to make it a lot easier to know where they should be and have the right setting or the right level of care for them. So yeah, it certainly doesn't hurt to have a cognitive screening and to be aware of the stage they're at and where they would best fit. Because it's sad for somebody to be in the wrong level of care, because it can be stressful for everybody. So. Was that the last question?